Welcome back to another edition of TCM Graduate TV. I'm Ken Stefsik, registered acupuncturist. This is episode 146, and today we are talking about the next heavy hitter on the REN or CV channel, REN23. But before I do, I've got an honorable mention for you, and then I've got another honorable mention right at the end. So let's look at, we talked about REN17 last time. REN18, 19, 20, 21, not really using them in the clinic too often. REN22 is an honorable mention slash almost heavy hitter. Now REN22 right here, really good to stop cough. Now the reason why I'm on the fence whether it's a heavy hitter or an honorable mention is because this acupuncture point can be tricky to needle, and it can also be a little bit disconcerting for patients. So alternatives include extra B1 Ding Chuan, as well as Jing Bai Lao, extra head neck 15. Now these both are indicated for cough and or asthma, and what it's doing when we soften this area back here is we are softening the accessory breathing muscles. Now, of course, we can also do things like UB23. If you've ever done shining skull breathing, you'll notice that your lower back around UB23 gets really sore because our lower back is an accessory muscle to breathing. So that's what it means when we needle UB23 to help the kidneys grasp the qi, grasp the air that's coming in through our lungs. So we've got a couple other really good options. We've got another good option here if we're talking about kidney deficiency to help with accessory breathing muscles. Now, REN22, typically what I would do is I would needle it, soften it, and then take the needle out. I think it's a little, again, disconcerting to leave that needle in for patients, but you treat how you like. That's the beauty of Chinese medicine. So REN22, definitely an honorable mention. Now, the reason why REN23 is such a heavy hitter is because I use it all the time in the clinic. This is excellent for sore throat. Now, when a patient has a sore throat, I ask them where. Is it sore in the back? If it's sore in the back, I'm going to use REN23. If it's more swollen, sore on the sides, I'm going to use SI17. Of course, for sore throat, we can prick to bleed, lung 11. We could use large intestine 5. There's other acupuncture points that we can use for sore throat, of course. But just so you know, I'm always asking the patient to help me put myself in their shoes so I can figure out what's hurting, what could possibly feel better. And then, of course, the other honorable mention is the last acupuncture point on the REN channel, REN24. This helps regulate saliva. So anything to do with saliva, REN24 can help you. So that means if you have a patient and they say they have excess saliva in their mouth, you can needle this acupuncture point. And if they tell you that they have a dry mouth, you can needle this acupuncture point. So it regulates saliva. I believe its Chinese name is something like fluid container or something thereabouts. So there you have it. The last 3 acupuncture points on the REN channel that I consider honorable mentions and or heavy hitters. REN23, using it all the time. REN22, like I said, I'm going to jump to these first. Ding Chuan, Jing Bai Lao, check to see if they're tight, soften them up. And then some other great acupuncture points, REN24 for saliva. Just want to remind you that safety is king, bedside manner is king, and results are king in that order. Thanks for watching this video.